There's something special about childhood. A sense of wonder, a sense of hope, and a sense of joy. Children have great potential when they feel safe and secure. However, many children in our communities are not safe. They are not secure. There were over 10,000 reports of abuse involving children in Marion and Polk counties last year. When there's a concern of abuse, children need to have someone to tell. They may need medical attention, and parents or caregivers may also need support. Liberty House helps make responding to concerns of abuse or neglect easier for children and families. We offer a welcoming, private environment so children can feel safe and heard. Children can be seen by a pediatric medical provider who is specially trained to recognize signs of abuse and neglect. Our forensic interviewers create an environment that allows children to talk about their experiences. An assessment is set at each child's pace. We take whatever time is needed to help children feel comfortable. Family support specialists provide support and resources available for families. Because child abuse is a crime, agency partners from our community meet regularly so that concerns of abuse are responded to quickly and effectively. Through coordinated work between agency partners, children can get the help they need with fewer appointments. Children can also receive counseling at our Hope and Wellness services on the Liberty House campus. Therapists with special training and understanding trauma help find pathways of healing for children. In therapy, children begin to make sense of their experiences. Feelings of guilt and shame are replaced by feelings of worth and potential. As an organization, we dream of a community where children feel safe. Our prevention department provides education and training to adults and youth throughout Marion and Polk counties. It is possible to create safety for children in homes, at school and at play, and in the evolving digital world. All members of our community play vital roles in meeting the needs of children. Together, we can create a community where children can feel safe and secure. Children can heal from abuse and neglect. Liberty House knows how to help children find a pathway to healing, a pathway to wonder, hope, and joy.
Hello, welcome to InSight. I'm Wendy Brokaw. Liberty House is the Children's Advocacy Center serving Marion and Polk counties. Their mission is to assess, treat, and prevent child abuse, neglect, trauma, and grief in order to promote hope in children, youth, families, communities. Their website sums this mission, changing hurt into hope. While child abuse is common, it is possible to heal, and it is largely preventable. So how does it work? What really works to prevent child abuse and neglect, and especially to truly heal? Would you please welcome my guest, Alison Kelley, the Chief Executive Officer of Liberty House. It's so good to see you again, Alison.
Great to see you, Wendy.
Well, first of all, can we start with congratulations? 25 years. This is your 25th anniversary.
It is, just this month.
And you are celebrating with a ribbon cutting just last week as we record for your new clinic in Woodburn.
Yeah.
Why Woodburn?
Great question. Woodburn is an area in our local community that is growing really rapidly. And we have many families who have come to that area for lots of important reasons, and sometimes just the distance between those areas in Woodburn and around Woodburn, all of North Marion County, can make it difficult for children to receive the resources that we offer at Liberty House. So we decided to take our healing services closer to where children and families live to make it easier.
What are your locations?
The original Liberty House Clinic is located just off the MLK Parkway in North Salem, and that's where we provide the bulk of our resources. We have a satellite clinic located in West Salem to make it easier for children and families in Polk County, and that's where our community engagement and prevention teams also have their offices. And this third location that we will be opening for services toward the end of May is in the central part of Woodburn, and that will allow us to serve children and families in Woodburn and North Marion County.
The movie we just saw was really a good explanation of what your services are, but something caught my attention. Ongoing needs. You talked about ongoing needs. What do you see as your greatest ongoing need?
Well, for us as an organization, we are always looking for talented professionals to join our team, including mental health professionals. We offer a specific type of therapy called trauma-focused therapy, and that really helps children to process the experiences that they've had, to learn that whatever they have experienced was not their fault. A lot of times children assume that it was. And to help that trauma loosen its grip so children can begin to envision their lives without the trauma and envision their future.
Is this therapist shortage just here, or is it rather statewide?
My understanding is that many communities could use more therapists and are experiencing a little bit of a shortage. The specific type of trauma therapy really requires some skill, and it isn't easy because the things that children have experienced that led them to this point, those things are not easy. They can be very toxic. And so it's really important for therapists to attend to their own emotional landscapes. That's how they can stay healthy. That's how they can be healers, have a healing presence, if they can maintain that contact with their own joy and wellness.
This type of therapy, it almost sounds as though it's been tried and it really works better than, let's just say, another kind that has been more traditional.
There are many different modalities that we use. One of the most common types that we hear about is called trauma-focused cognitive behavioral therapy, which is a more specialized form of talk therapy. There is another therapy called EMDR, which stands for eye movement and desensitization reprocessing. It uses ingenious research about how the brain works, and that takes some special training. And there are many other types of modalities. Internal family systems therapy is sometimes recommended, but children who have experienced difficult things, traumatic things, children who've been on the receiving end of abusive experiences or witnessed violence in their homes, it's not a one-size-fits-all. Our therapists will do a very comprehensive assessment to determine what the child's needs are, and then with a vast array of tools in their toolbox, they will work with the child to find the approach that the child responds to the best.
The ongoing need that we were talking about, it doesn't end overnight. The trauma, even though it seems to be abating in some way, you still need to work with that young child for a period of time.
It can, with a really good intervention, which involves very conscious and concentrated listening. I think everybody can relate to, what did it feel like the last time you were in a conversation and the person was so focused on you as if you were the most important person in the world? How that made you feel probably made you feel wonderful. And there is something healing about that deep level of listening. So what we see in children, if they receive a good diagnosis, have good, appropriate supportive caregivers or parents around, and can have access to follow-up trauma therapy, that trauma can loosen its grip. the fear, the PTSD, all of those things can loosen their grip so the child can begin to remember what it was like to just be a kid, to be joyful. And it does have this kind of therapy does have a lasting effect.
Let's go back to what your new clinic in Woodburn is going to offer, because that will incorporate a lot of what we're talking about.
Right, yeah. In our clinic in Woodburn, we will be offering the full array of diagnostic services that we provide in Salem. So that means we have specially trained pediatric medical providers, medical doctor or nurse practitioner, sometimes a physician's assistant. Child abuse medicine is a subspecialty in pediatrics, so it takes some extra training. There are a lot of nuances. So children will be able to receive a checkup if that's what they need. Sometimes children might have already been to the doctor, and so what they really need is an opportunity to sit down with a specialist that we call a child forensic interviewer. And that term just indicates an interviewing technique that's based on science. That's what the word forensic means. And that means that this person has learned how to create a safe environment for children to describe their experience, whatever that experience has been. We're neutral. Our services are neutral. We never presume that anything has or hasn't happened. But we need to help children feel safe enough to describe what they have experienced and not feel judged or pressed or pushed. No leading questions, that kind of thing. And then we also offer family support, which is so important. Sometimes parents and caregivers are really dealing with a lot of their own complicated emotions. And so our family support specialists will sit down with them and listen to them and find out what they need. And we have access to all kinds of resources to help point them in the right direction if they're having trouble meeting basic needs, or if they themselves would like to engage in some therapy to help understand how to manage their own emotions or their child's complex emotions.
Are parents more often than not surprised to be confronted with someone telling them your child is suffering from either abuse or neglect, or do they come forward themselves?
There is, as you can imagine, a really wide range of circumstances. What I can say universally is that it's just never easy on parents, no matter the circumstances. And so we really want to make sure we're attending to their emotional needs as well. Parents and caregivers, by and large, want the best for their kids. There's no doubt about it. And so we feel good when we can offer resources and support to help them really meet their kids where they are. And the kids will watch their parents very closely and watch their reactions. And so if everybody feels reassured, those kids do better in their healing. The goal is to allow a child to just freely describe what they have experienced. And then in Oregon, we have really good public policy that says when a child has gone to a children's advocacy center like Liberty House, if their team produces a report, that report can be admissible into evidence. And that can be helpful if there are offenders that need to be held accountable, or if there are decisions that need to be made about whether a child is safe. They want to put this child in the most safe environment. And that reduces the number of times children have to talk about things in front of a lot of different people. And so the goal is just to create that sense of safety so children feel relaxed and able to describe. And it's really important that we are neutral and independent. We are a private 501c3 nonprofit organization, and we never presume anything has or hasn't happened. Sometimes there are adults that have concerns about children, and what can occur in that forensic interview if a child makes statements, they realize that this thing wasn't really happening, but there might have been some other concerns, and now we just know a lot more because the child felt very safe in describing what was really the truth. So we do a lot more listening than asking.
And they are alone?
With an interviewer.
With the interviewer.
Yeah. And a dog. We have what we call a facility dog, a terrific black lab. His name is Eli. He has a big appetite.
That's wonderful. And it is important that the child be alone with the forensic examiner, because they are influenced by those around them.
It's a model that's based on about 35 years of research out of the field of psychology. I will say I believe there are 24 children's advocacy centers in Oregon serving 36 counties, and they're connected by another organization called Oregon Child Abuse Solutions. There are over 960 children's advocacy centers across the United States, and that speaks to decades of research about what is healthiest for children, what will create the optimum environment for children to be able to describe what they've experienced, provide the optimum set of help and resources for parents and caregivers, and help get the entire family on that pathway to healing.
Child abuse assessment, that's one of the legs of this tripod.
Yep.
Hope and wellness therapy,
Right.
prevention.
Yeah.
Together, they all form that service. Tell us a bit more about the wellness therapy.
And that's really what we have chatted about, that the therapeutic intervention. We have licensed mental health providers. Our director is a licensed professional counselor with 20 years plus experience in our community, working with all kinds of kids in all kinds of circumstances. And we offer that follow-up therapy because when children have experienced traumatic things, and when we think about trauma, we think about whatever has really overwhelmed. An overwhelming life experience is how we define trauma. And the trauma is less about the thing that happened and more about what happens inside the child, the disruption to emotions, how the brain will encode different experiences in different parts of the brain in order to protect the child from feeling the full brunt of whatever the reality was. So the process of therapy is to help heal those memories and heal that fragmented sense of self so that children can learn, I am a real sense of self and I have a future. And then the prevention education we are really excited about, because researchers will tell us that 99% of all child maltreatment is completely preventable through education and training of the grown-ups around kids.
What do you do?
Well, we have a wonderful training called Stewards of Children, and that specifically helps adults learn how to keep their children safe from the threat of sexual abuse. And that is really, really important. We make it safe to talk about. Everybody these days has cell phones. Lots and lots of kids have cell phones. Cell phones are the gateway to all things cyberspace, and that is a super dangerous area for kids. Social media, when unmonitored for kids, can be a gateway toward really harmful things. And so we can provide lots of different types of courses for parents and caregivers to help learn how to maybe have a family discussion about cell phone use, to maybe make an agreement, help parents learn what are safe ways to monitor your children's habits, and also help kids learn that although so many kids feel and are told or threatened to send personal pictures of themselves in order to get somebody to like them, should never feel like they have to do anything to get people to like them. Love or being liked, it's not supposed to be a transaction, right? Safe people will like you or love you just because you're you. And that's a message we want to be able to share with kids in our lives, that you're worth it. You should never feel like you have to send that thing.
So many children's phones now are connected to the internet, and right there, that lets a floodgate open.
It does.
And they're ill prepared.
Yeah.
And sending images is one thing, but it opens up cyberbullying.
It does. Yep. And all kinds of difficult things. So that's why we start early. We're writing a curriculum right now geared towards 6th grade, and working with our local school district, we've piloted that curriculum, and it's currently being evaluated by a professional team out of the University of Oregon.
Oh, what does it involve?
It involves just those things I just mentioned. Just learning, like it's really cool to be human. We all do things to get liked or loved. We may not always be aware that sometimes those things we do could actually put us at risk, and that nobody should ever have to feel like they have to send that picture in order to get somebody to like us. Safe people will like us just because we're us.
You mentioned talking with the school district, a kind of a collaboration with them, and I'm sure you have partnerships with other organizations that help fulfill that community need. But what I would like to know is, you've had explosive growth in just the last 10 years. Wow. What is going on with Liberty House? What happened? Walk through.
Well, we just try to listen. We really do. We try to listen. 10 years ago, we put out a survey among our most frequent partners, important stakeholders, and we said, how are we doing? What can we do better? What do you need? And with that feedback, we learned that we needed to expand, and so that's when we bought a building next door and doubled the size of our clinic. And it's really our board of directors. We have incredible leaders on our board of directors. And so we just keep listening. Our community was the one that said, you guys should start a mental health therapy program. So we did more focus groups, and that's why we started that program. One of the law enforcement professionals that we work with said we really need a mechanism to help kids understand the risks of things they do on their phones. And so we did more focus groups, and that's how we launched irespectandprotect.com. It's a free resource, there's a whole website and everything. And it was our community and our partners up in Woodburn that said, would you please open up a satellite clinic up here? So we just try to listen, and then we double check. And then we can't do it all alone. Liberty House is the community's resource. And so we just ask for help, right? Asking for help when you need help is a super healthy thing to do. And that's what we do. And our community has rallied around and said, no, we really want these. Yes, we want these resources. We'll help. So we're super grateful for that.
So you just mentioned that people come to you with ideas. That's interesting to me.
Yep.
What are some of the things that perhaps law enforcement has suggested to you?
That was one of them. We had a law enforcement officer say, I just wish there were a way that we could help teens understand that if they send that nude picture of themselves, which is just a practice that a lot of kids just assume they have to do, right? That's not a judgment, it's just kind of assumed. But that picture you'll lose control over it. It can go everywhere, be all over school. And if we feel that a little bit of advanced information at least will give kids and teens a sense that they have choice. If they feel like they have some choices, that can be really empowering. So that came from law enforcement. Law enforcement said, we like your services, but you need to see children more promptly. So 10 years ago, it could take 2 to 3 weeks to get a child scheduled. Now we have the capacity to see children the same day if it's early enough, or the next day. And so we have listened to what they need in order to do their jobs, because I will say our law enforcement professionals put their lives on the line for us in our community every single day. And we owe them our respect and a debt of gratitude. So we can help by being as responsive as we can to make our services as available as possible.
What's the front line of defense for spotting child abuse? Do people know the signs? How can they know what do they use to gauge whether or not they should even say anything, be it a pediatrician or someone else?
Those are complicated questions. The first thing that I would say is that parents and caregivers matter. They really matter. And it is not easy being a parent. I speak from experience. It isn't easy. If parents well, first of all, the other thing I'll say is that we have a lot of families close by who are working so hard just to keep their families going. We know parents are working 2 and 3 jobs, so I'm going to be the last one to give anybody advice. What I will say is that parents, by and large, really want the best for their kids, and kids appreciate the time that gets spent. They go through phases where they hate their parents, but they kind of hate the parents and really want boundaries. They want to be able to ask them things. So everything that a parent or caregiver can do, maybe even just a little bit more, one night a week we do phones down at the dinner table and play a game, that kind of thing. Whatever their instincts are that would work to build that relationship. If kids have a trusting relationship with their parents, they will be able to say, so there's just this thing happening and I don't know what to do. And so the relationship matters. Getting educated, learning. I would encourage anybody who might be curious about online safety to visit that website, irespectandprotect.com. Free resources for parents, teachers, coaches, and youth as well. And just listen to kids. It just matters.
How can people help with your mission?
Well, we're grateful for anything that people can do. I would encourage people to go on the website, libertyhousecenter.org. There's a wish list of small things that our clinic can use, or our therapy program. We have 3 events each year. We do quite a bit of fundraising. The reason we've been able to do all this growth is because of the community has come alongside and supported us financially. And we deeply, deeply appreciate that. But we really appreciate those sustaining donors. And come on a tour. The first tour Tuesday of every month at 5:30, we offer tours of our facility.
I didn't know that.
On the main campus. Yeah, and it really can help people to just hear a little bit more in a relaxed setting and see the clinic and meet some of our employees.
If you could tell parents anything right now that would go a long way to protect and keep their children safe, what would that be?
Well, I would just say thank you. Thank you for being parents. Thank you. It isn't easy. And we're here to help, and you matter. Parents matter. Anything that they can do, a little time spent goes a long way, even in a busy time. There are lots, and as I said before, there are lots and lots of parents who are working super hard, and life just isn't easy right now. It just feels really complicated all the time. So anything that they can do to trust their instincts and spend time with the kids, build that relationship, and then be a good listener. The last thing that I would say, if any parent were in a conversation with a child and the child began to say something, disclose something, try as best you can to just breathe and be calm and know that you have resources in your community. Let your child know you were very brave to be able to say that. We have some resources. You did the right thing. It's really hard, even if parents are already navigating their own emotion, their own shock, their own hurt, their own dismay. It's a really important moment to not panic and know that we're here to help.
Sounds like you're really trying to reduce any stigma.
Yeah.
Any stigma around it that the child might be feeling, that the parents.
Yeah.
Reducing the stigma of just opening up about the difficulties.
I love that. That's a great way to frame. Yeah, absolutely. Making it safe to talk about. It's okay to talk about these things.
Talking about it leads to solutions oftentimes and makes you feel that you can actually avoid the difficulties or deal with the ones you're facing. I'm thinking of those children who over the last 25 years have been helped long ago. Have any come back to say anything to you about it?
As a matter of fact, yes, there have been. And there is an amazing young woman who now is just a radiant, happy, incredibly functioning professional, able to have an incredibly joyful family. She got the right intervention at the right time. And she's symbolic. She represents the goodness that can come. We've helped over 15,000 children in 25 years. And it is so exciting to know that that intervention has made a positive difference in the lives of those kids.
Alison, thank you so much for being my guest today and talking about what Liberty House is doing, plans to do, and has done.
Thank you for having me.
And thank you for joining us today on InSight. I'm Wendy Brokaw.